Hey, it's Ed here. Welcome to another edition of Ed Talks. I thought this one would be super interesting, just sort of exploring other cultural type things that happen in healthcare. And there's no one better than my friend Arshia Wajid to talk to us about some of the things that she's been doing in this particular area. Arshia, welcome to Ed Talks.
Thank you. Pleasure to be here.
Yeah, it's great having you because you and I first connected in 2018 in Cleveland. And so I think you and your organization that we're going to talk about, we're doing a fundraiser, and I was invited to be one of the speakers, and it was super fun experience. And so I always remembered that for a couple of different reasons, and so we've remained connected, and so here we are. So again, I'm thrilled to have you and for you to share what you've been doing in terms of the American Muslim Health Professionals Association. So before we get started, though, let's talk about travel because I know you're a world traveler. What's your favorite place to travel to, or one of your favorite places?
So, one of my favorite places is New Zealand. I went there in 2016 and absolutely fell in love. It's just beautiful. It's you feel like you're driving in a postcard because everywhere you look, the landscape, it's just a beautiful country, and I really enjoyed meeting the people there. The food is excellent, so highly recommend for anyone who hasn't been there. Yeah.
Yeah, that sounds very lovely. Although it's quite a distance away, right, from the United States. Takes a
That's
little while to
true.
get there.
That is true. Yeah.
So tell us a little bit about yourself. Like, what's your background?
Sure. So I was born in the US, and then when I was really young, we moved to India for a few years, which is where my parents are originally from. And then we moved to Kuwait. My father got a job there, and he did the medical field as a physician, and we lived there for a few years. And then during the Gulf War, because my sister and I were U.S. citizens, the U.S. government was evacuating as citizens, and so my family and we ended up moving back to the U.S. In 1990. And so I live in Chicago. Chicago has been home since then. I've lived in New York for a bit for a fellowship, but predominantly most of my family, my relatives, cousins, they're based here in Chicago.
So that's cool. I mean, that's a very international upbringing. So India, and then moving to Kuwait, which had been another different type of culture, and then of course into the United States, a sort of a third culture. What part of India did you spend the most time in?
Hyderabad, that's where
Okay.
my parents are from.
All right. Very cool. And tell us a little bit about your career as well. So obviously you're in healthcare. Tell us what you do.
So, in terms of my career path, my background, I have a master's in public health and an MBA. And I did a fellowship in hospital administration from Stony Brook Hospital in New York. Early on in my career, I actually worked at a federally qualified health center, and then later on worked at a community hospital before I moved on to working in Northwestern medicine. But really, when I started off in that early years of my career, I had a chance and I got exposed to health inequities. And worked in underserved areas and underserved communities where I really got to see the haves and have-nots, and how access to care is determined by the zip code that you live in, and even your life expectancy is determined by the zip codes you lived in. And so it was interesting to kind of get exposed to that early on in my career. And then, of course, subsequently, I moved on to other health systems that were much more well resourced and well equipped, like Northwestern Medicine, Rush Health System, Advocate Health. And I also did healthcare consulting for a few years. But again, I feel like those early careers kind of gave me that exposure to public health notions and even the social determinants of health that determine the life expectancy and access to care for uninsured populations.
Yeah, that's very cool. Yeah, let's talk about your NPO, your non-profit organization. So American Muslim Health Professionals, again, that's where you and I first connected. So tell us about it. Like, how did the founding happen? And then we'll go a little bit into the mission and vision.
Sure. I started American Muslim Health Professionals in 2004, but the idea came about a little bit prior to that, where I felt that there were a lot of American Muslims who were doing amazing work in the healthcare sector, whether they're entrepreneurs and building startup companies, or they were physicians, nurses, clinicians, or they were non-clinicians like myself, who I was on the healthcare administration track, and so I felt that there needed to be an organization, an entity to kind of bridge the resources, pull them together, and kind of foster collaboration and dialogue between them, so that we can help each other. But then, more importantly, how do we better serve the needs of society, and address the public health needs in society? So that was kind of like really the idea behind why I wanted to start American Muslim Health Professionals. And so in 2003, for a year, when any conference that I attended, any events that I attended, I started collating names and emails of individuals, who I thought might be interested in being part of this organization. And so in May 2004, I basically started a Yahoo group back then and connected all these individuals. I had about 100 names or so. And within a few weeks, we went from 100 to over 600. And so it kind of became viral. And we had health professionals from all over the US joining, and really interested. And of course, I say viral, with the context that back then 600 was viral.
Right.
Today, it would need to be 6 million or so in order to be considered that. But really, it kind of spoke to the notion that there were American Muslim health professionals who really, truly were interested in figuring out, like, how do we kind of all collaborate and work together. And so that was kind of like the premise behind it. There was a national conference coming up in 6 months, and you and I coordinated a meeting, an in-person meeting. And initially, I asked the organizers to give me a room for about 20, 25 individuals, is what I expected. We had a standing room of over 75 people who came, and we formed committees. We created a mission statement, a vision statement. And that's kind of how Jump started, even though in my mind at that time, when I started the listserv, I didn't envision it to really form an organization until another 5 years, until we develop a critical mass. But I think there was just a lot of interest, and so that's kind of like what kind of brought about this notion of, like, yes, we can all kind of work together to do something. And so really our three core areas of focus are professional development, mental health, and policy for and advocacy for underserved communities.
Yeah, no, that's great, and applause to you for seeing the need, organizing something, bringing people together that have similar faith and values, and establishing something. And you've been around for a long time, right? 20 years, you were saying.
Yes, that's
Yeah.
correct.
So you survived the test of time, and you definitely adding a lot of value to your colleagues here within the association. What's next? Is there any big thing that you all are working on together?
Yeah. So, one of the things that we're focused on is, how do we create an actual institution that will outlast myself and my board members? And so the board is very much determined to create an actual institution. And so, with that in mind, we've been very actively focused on fundraising and sustainability. But also, part of that notion behind creating an institution is, how do we move from a board run organization to one that's actually run by staff? And to that end, we've got an investment from key donors and funders. And we've hired a full-time executive director. We've also hired other staff members to oversee the programs and to grow those programs, which again takes it away from board members who are obviously, they're already fully committed in other arenas. So now we actually have an institution which is like run by staff members, and the goal is that we continue to grow. The other thing that we're also doing is expanding into chapters. So we started off as a national organization, And while we've done a lot of great things, at the end of the day, we also recognize that in order to create true changes, you really need to be at the grassroots level. And the way to do that is through chapters. And so we now have a chapter in Chicago, in the DMV, DC, Maryland, and Virginia metropolitan area, New Orleans, and Texas. And so the idea is to kind of really build this playbook around these chapters that we can then take and scale into other states as well.
Yeah, that's great. And so, Arshia, if people want to get involved, what should they do? Should they go to your website?
Yes, if they go to our website, amhp.us, they can sign up to our newsletter and stay in touch with key updates. We also have WhatsApp groups in a few different cities that they can sign up if they want to get involved at a local level. So we highly encourage individuals to subscribe and stay in touch. We're also having our 20-year anniversary gala in Chicago this year on Saturday, October 12th. So we would love to have individuals attend that and be part of the celebration with us.
Yeah, no, that's awesome. And we'll also put all that information in the show notes. So if anyone missed it while they're watching, just check the show notes. We'll have the website where you can sign up to the newsletter, find out a lot more information. Arshia, this has been super, super interesting. And again, from a leadership perspective, I applaud you for what you've done, the people that you brought together around a common core mission, and I think that's fabulous. So thank you so much for being a guest on EDTalks.